I see your message, sir. Yeah. Good evening, everyone, and welcome. Okay, we are live right now. Yeah, we are live on Facebook and YouTube. Happy Sunday, everybody, and I hope we're having a great session. Today, we are talking about cervical cancer prevention. What is new? And I have a guest joining us, one of our teachers. He's already in the house. If you can hear me, everybody, just tell me, yes, I can hear you, and tell me where you're joining me from quickly so that I can bring in our guests. This network may do well. Oh. Okay. Let me bring up Dr. Qudus Lawal. Good evening, sir. And how are you doing, sir?
Good evening, Fred. I'm fine. And you?
I'm doing very well. Thank you so much for making out time to join us today. We are sincerely grateful, sir.
Thank you very much for having me. It's great to be back here again.
Yeah, ladies and gentlemen, we have Dr. Qudus Lawal, consultant obstetrician and gynecologist at the Ira Specialist Teaching Hospital. He's very passionate about cervical cancer, and he's been having so much campaign on cervical cancer awareness, and we thought it very right to have him here tonight to answer all our questions about cervical cancer. So in case there's anything that's not clear to you about cervical cancer, you are on the right platform tonight. I can see that we have some people already joining us. So if you have any questions, please take note of your questions, and then later in this program we will be taking your comments. Josephine, I see you. Welcome. Anyanwu Philip, I see you. We are live on Facebook and on YouTube. So, sir, when we mention cervical cancer, I'm very surprised that people still ask me, what are you talking about? So when I made a post, I think 2 weeks ago or last week, and I asked, have you screened yourself for cervical cancer? What I got was that, what are you talking about? It baffled me that some people, even at this point in time, still don't know what cervical cancer is. So, can you help us break this down for the layman? What exactly is cervical cancer?
Thank you very much. And what you just alluded to is the reason why we should not rest, rest on our house on informing the public about what cervical cancer is. And more importantly, the fact that it can be prevented. It's important the public should know that this monster that's taking the life of women is something that we can prevent. So, what is cervical cancer? First, we need to know what the cervix is before
Mhm.
then talk about what cancer is. They'll put the two together. The part of the woman, of course, is the woman that has the cervix. Now, the part of the woman, the part of the womb, to be precise, that opens up during delivery. You usually hear doctors talking about a part opening up that it gets fully open before a baby comes out. That's what the cervix is. In other words, is the neck of the womb. Now, this neck of the womb, just like any other part of the body, can undergo abnormal growth. That is an uncoordinated growth. Uh, Normally, growth occurs in all parts of our body, but it's coordinated under some form of regulation. But when this regulation process is lost, there is an abnormal, uncontrolled growth, and that's what we call cancer. And cancer generally can start from a place, then it gets disseminated, it gets distributed all through the body, and eventually causes ill health and death if not taken care of. So when you have cancer at the neck of the womb, that's what we refer to as cervical cancer. Now, this cancer is unique. Excuse me. This cancer is unique in many ways. It is the commonest female cancer in this part of the world, just second to breast cancer when you talk of women cancer. But when you talk of cancer of the reproductive tract of the woman, cervical cancer is the commonest cancer. It is a cancer that we know everything about it, and when I say everything, I mean every part of what I said. All that needs to be known about cervical cancer is known, unlike for many other cancers where most time we cannot really say what is responsible for such cancer. For cervical cancer, we know that it arises from a common infection that affects women, that affects everyone generally. That's human papillomavirus infection, which is a sexually transmitted infection. So almost every person that is sexually active during the course of their lifetime will have this infection. But it is the persistence of this common infection that results in this complication, which we call cervical cancer. Now, this persistence of the infection, when it's not cleared, most people are going to clear. Majority of more than 70% of women will clear this infection within 2 years. But when this infection persists for a long period of time, then some processes occur in the cervix. Again, this cancer again gives us a grace of time. Unlike some other cancer, it gives you up to 10, 15 years process. The process.
Hello, sir. Sorry, can you hear me? I don't know what's happening. I guess your network is breaking. And somebody is also saying, please, let's see, the speaker should speak louder. So I don't know what happened. It was cracking up. Let me bring you back again. Hello, sir. Can you hear me now?
Yes, I can hear you. Can you hear me better now?
Yes, I can hear you loud and clear. Okay.
Okay.
So, yeah.
I
So,
unfortunately I don't know where uh, the last point you heard me from, but I'll just go back a little.
yes, we're talking about, you said anybody who is sexually active can get infected with the HPV virus.
Yes. Okay. Let me take it from there. So,
Yes.
almost everyone that is sexually active will get infection from human papillomavirus. It's the commonest sexually transmitted infection, by the way. So, majority of people, 70% of women will clear the infection within 2 years of the infection. But in some people, this infection will persist. And it's the persistence of this infection that leads to cervical cancer. But it's not like you get infected with human papillomavirus today and cervical cancer develop the next day. It takes a long period of time, and this long period of time is an opportunity for us to intervene between the infection and cancer developing. On the average, it takes up to 15 to 20 years after an persistent infection before cancer develops. In the period between that, there are some changes that occur in the woman that we can pick on and intervene to prevent cancer from happening. By and large, this is what cervical cancer is all about. It's also important to mention why the infection will be persistent in some people. There are risk factors that make the infection persistent in some people. Women with multiple sexual partner. Then I need to mention at this point too that the fact that it's a sexually transmitted infection does not mean that anybody that has a human papillomavirus is promiscuous. So human papillomavirus is not an infection of promiscuity. It's an infection every sexually active person is likely to come across with. But the likelihood of having the infection is higher with more sexual intercourse. Now, apart from that, there are people who call high risk male. If the partner is high risk, for example, uncircumcised partner, partners that have many sexual intercourse, many sexual partner can actually also increase the chances of a woman developing cervical cancer. Also, a woman that smokes can have an increased risk. Then women that have immunosuppression, for example, HIV positive patients are at increased risk. They're said to have about 6 times the risk of the general population in developing cervical cancer. By and large, that's a summary of what cervical cancer is all about.
Thank you very much. Good evening, everybody. If you're just coming, you're welcome. We're talking about cervical cancer today. We have our guest, Dr. Qudus Lawal. He's a consultant obstetrician and gynecologist. He just told us what cervical cancer is all about and how we can get the cervical cancer for ladies. So I want us to go forward a little bit. The symptoms of cervical cancer. What should a woman look out for? And should she wait before she develops symptom, or she should pay attention to her health at the very beginning? What should any woman look out for with regards to cervical cancer?
Thank you very much, Dr. Fred. First thing, we do not want, and it is not our wish that the time a woman will get to know about cervical cancer is when she starts having symptoms. By the time she starts having symptoms for cervical cancer, it's already late. But again, we should know the symptoms so that when they have at the first occurrence of the symptoms, they can present to a doctor to seek care. So I will mention the symptoms, but
Whoa,
again,
what
before we
happened?
get to discussion, what to do so that
Hello,
the
sir.
symptoms will not.
Okay.
Am I audible?
Yes, 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 you are. You are. Okay, please
All right.
go over
So
again. Yes, sir.
the symptoms a woman is likely to have from cervical cancer include abnormal vaginal discharge, foul-smelling vaginal discharge, uh, post-coital bleeding. And what is post-coital bleeding? That is bleeding after sexual intercourse. Excuse me. Um, Low abdominal pain, weight loss, not feeling like eating, even bleeding between menses, or postmenopausal bleeding. That is bleeding in a woman who has already achieved menopause. Any bleeding after menopause is abnormal until proven otherwise. So such a woman should present to the hospital. Now, I need to emphasize that even though abnormal vaginal discharge, bleeding after sexual intercourse are said to be associated with cervical cancer, it does not equate that any woman that have these symptoms have
Mm.
cervical cancer. It just means that once you have any of these symptoms, you should present to the hospital and get care and get evaluated for those symptoms, and appropriate care will be given to you.
Okay. Now, the symptoms you listed, I believe that there are other medical conditions too that can cause this. So, just like how Dr. Lawa has mentioned, if you have any of the above, you should please speak with your doctor. The very important stuff I know a lot of people will be asking right now would be, can it be treated? Is there a cure for cervical cancer, or is it something that when I have it, it's going to be with me for the rest of my life?
Okay, that's another important question you've asked. Now, cervical cancer can be treated. Again, it's one uniqueness of cervical cancer. Unlike many other cancers where we have limited options of treatment, for cervical cancer, we can treat it. But again, I need to make this comment. Treatment of cervical cancer is best when it's detected early. The later it is in your detection of cervical cancer, the less likely you're able to treat and give appropriate treatment. It's also important to note that there are challenges with the treatment, especially in low and middle income countries. So emphasis is on preventing it. But in terms of treatment, I'll just quickly go through the options of treatment and highlight the challenges we have with such treatment. For a woman that presents in the very earliest stage of the disease, minimal surgery can be done. Just such patient that is the
Or what happened?
very earliest. Hello.
Yeah, we lost you a little bit, but I guess you're back.
Okay. So at the
Yeah.
earliest stage of the disease,
Yes.
just cutting the cervix alone might be curative for such patients. That's what we call stage 1. Stage 2 include removing the womb completely along with the cervix. Or we do what we call radiotherapy. Radiotherapy is just in a layman term using something that looks like the X-ray machine that we all are aware of. But this one is for the purpose of treatment to treat a woman, and usually that is amenable for the early cervical cancer. But once we got into what we call locoregional disease cancer, the option of treatment is actually usually limited to um, radiation therapy. And again, I remember I mentioned that this is usually a challenge. The number of radiotherapy machines that we have in Nigeria is limited, and more often than not, they often break down because of the pressure. The radiotherapy machine is not just for cervical cancer; we also use for all form of cancers, and there are a lot of patients or lot of cancer patients that will require this facility. So more often than not, it's always breaking down. And again, the cost of such treatment is expensive, and that is why for us in the cervical cancer advocacy, what we usually emphasize on is prevention, prevention, and prevention. We all know that prevention is far, far better than cure. You are muted.
Oh,
Fred, you are
so
muted.
sorry. Yes, yes, yes. Thank you very much. Um, Dr. Lawa mentioned about early detection is very, very important, and the chance of management is tied to the time of detection. I know we have people who want to ask us questions. Please Just hold on. We'll take your questions. I can see your question, but I want to appreciate this person, Joseph. Joseph just sent 50 stars. Thank you very much. One important area, ladies and gentlemen, don't worry. Okay, let me ask him. Let me ask him since you are just coming. But do me one favor, please share this live stream. Sir, this question is here. I guess they missed it at the beginning. What causes cervical cancer? From EVA. Again, Ukeria is asking us again, please, what's the cause of cervical cancer? So let's take it again, please, for them, sir.
Okay, thank you very much. And we can overemphasize this, and it's the right of people to know what causes the disease. And it is when they know what causes the disease that we're able to take action to prevent it and reduce the problem that we have with the cancer. Now, first of all, the cervix is the neck of the womb. So, in just in case you don't know what the cervix is, and now, what causes it is that is results is one cancer that we know it's caused, unlike many other cancer, and it results from an infection which we call human papilloma virus, which is a common infection. In fact, some people often refer to cervical cancer as a rare complication of a common infection. Human papilloma virus is a very common infection. Almost every sexually active person, be it male or female, you have this infection once in their lifetime. It is said that more than 70 to 80% of sexually active women will have it in their lifetime. The same thing applies to male. So it's an infection that everybody will almost always come across in encounter with once they are sexually active. However, the body has the ability to clear this infection within a pace of 2 years. About 70% of women would have cleared this infection. But however, in some situation, when the infection persists and is not cleared, it causes some changes in the cervix, which eventually results in abnormal growth that is not controlled, and invariably it results in cancer. And I mentioned earlier that cancer is an abnormal, uncontrolled growth. So this is what leads to cervical cancer. But the good thing is that cervical cancer development is not like you have infection today and the next day you develop cervical cancer. It takes a long time, and this long time is in the range of years. And I mentioned earlier that it's as long as 10, 15, and some of people have even said up to 20 years between the infection and development of cancer. So this long period of time between the persistent infection and development of cancer is an opportunity for us to intervene to prevent the disease. And this is the importance of this conversation we're having today. A lot of changes are going to occur in the cervix that the doctors can detect and see and say, okay, see this cervix I'm looking at right now today. If nothing is done in the next 10, 15 years, this person is going to develop cervical cancer. Let's do this and this and this to prevent this woman from having cervical cancer. This has been done in many parts of the world. In most developed countries, they've been able to effectively reduce the burden of cervical cancer. In some part of the world, they will be eliminating cervical cancer. I'm sure we'll get to what we mean by elimination when we're talking about what is new about cervical cancer. So, in some part of the world, they are about on the verge of eliminating cervical cancer. And I give a precise example. Australia will be eliminating cervical cancer by the end of this year.
Hmm,
So
hmm.
nothing is stopping Nigeria and other low and middle income country from achieving it. Smallpox was a big disease. It killed a lot of people, our forebears. Today, our forebears are made it such that smallpox is not a disease we are worried about. It is our duty. It is a task that is on us to make sure that the future generation will not have to bother about cervical cancer. And that is why I will call on everyone listening today to make it a point of call that they will be actively involved in preventing cervical cancer in themselves and all their loved ones around them.
Thank you very much. I believe Evie and who else again? You got Dr. Lawal's explanation. Before I ask my next question, please, ladies and gentlemen, help us share this live stream. Let's share. The more you share, the more people will have opportunity to come and learn. It's not easy to have a specialist like this in our midst every time. And then I want to appreciate those that are sending stars. So I want to ask you this very, I don't know if it's a blunt or a lame or just direct. how bad is cervical cancer? When we're talking about it, it looks as if we are trying to overblow this whole discussion, trying to make people get scared. But in practice, what you have seen, how bad is it?
Yeah, Fred, I'll tell a story. And I think the story will resonate with many people that are on this call and will make us understand what cervical cancer is in terms of how bad it is. Many will have been wondering, as a guy, why am I interested in cervical cancer? Why bother
Yes,
so much
yes,
about it? That's the question. A lot of people are asking that question. And I tell the
yes.
story. Cervical cancer is something that I've known since medical school as a student. It's
Mm.
something I read in books and I was taught as a lecture. And it was just mere figure, mere data, mere information that is provided to me that I kind of cram and write out when I'm asked questions about it. But as house officer, as an intern, as a house officer, I got a little closer contact with patients with severe cancer by clerking them. But then the contact was not so profound until when I went for my youth service. And then I got to have a direct contact with severe cancer. And the way I put it is that women with severe cancer die from the disease, but they don't just die from the disease, they die in misery. They smell. Now, when I say smell, there is a typical smell of cervical cancer. For those of us who are doctors, or those that work in hospital, we will know that, oh, once you enter a ward, you would say that, oh, there's cervical cancer patient here. They bleed. When a cervical cancer patient is bleeding, you'll be traumatized looking at such a patient. Then again, they usually suffer a lot of pain. And to say that this disease is something that can be prevented by just sparing 2 to 3 minutes, or say maximum of 5 minutes, to do what is appropriate, or spending a few thousands to take as a form of prevention measures to get prevention activities done on one, then you would know how terrible it is seeing such women undergoing such misery. A single death from cervical cancer is one too many. And that is why, again, it is important that we should not um, look forward to seeing patients with cervical cancer with symptoms presenting to hospital. What we want to emphasize is that nobody, and I repeat, nobody should have cervical cancer. And to achieve that, it's a task for you and I and everyone on this call.
Thank you for this story. I believe this story resonates well with so many of us here. Let's go to one very important area, and that is prevention. There's this saying that says prevention is better than cure. We also know again that prevention is way cheaper than cure. Is it possible to prevent cervical cancer? Yes. If yes, how can we prevent it? As a single, how can you prevent it? As a couple, how can you prevent it? As parents, how can we prevent cervical cancer?
Thank you very much, Fred. Let me just add to the statement you made that prevention is better than cure and that prevention is cheaper than cure. But beyond being cheaper, prevention is more available in terms of severe cancer. Prevention is more available than cure.
Hmm.
Prevention is more accessible than cure. Prevention is more everything than cure. So we, of course, when a woman develops cervical cancer, we try to cure the woman, but prevention is the key thing, and is what is a message I am focused on passing across to our listener. Now, how do we prevent cervical cancer? The prevention of cervical cancer is derived from the fact that we understand the disease very well, right from what leads to it to the process for which it gets established as cancer. So this understanding has made us know everything about cervical cancer. And the foremost means of preventing cervical cancer is the use of screening. Screening literally means putting a form of test on a person in order to detect a person that does not have a disease, a symptom, in order to detect the possibility of that person developing the disease in future. And that's what screening is all about. So screening was what was used over the years in 1940s till about 2007 thereabouts. Screening was the main thing then. Then 2007, Asin developed a vaccine detected. First, it was detected in the 1979 that HPV virus was what was responsible for cervical cancer. Then, eventually, a vaccine was developed for cervical cancer in 2007, 2008, thereabout, and the vaccine has been available ever since then. A different version of the vaccine have been developed. Now, having realized that we have all these strategies for prevention, and this is not being instituted, especially in low and middle income country. The World Health Organization met in 2018, followed it up in the World Health Assembly in 2019. They eventually launched an intervention which is aimed at eliminating cervical cancer. And when we talk about eliminating cervical cancer, it means that we want to eliminate the prevalence of cervical cancer by 100,000. And how do we achieve this? We intend to achieve this by ensuring that all girls below the age of 15, between the age of 15 and 24, get vaccine. Just the same way we vaccinate our children, or the same way we got vaccine for COVID to prevent COVID,
Hello,
or this.
sir. Sorry, we missed the part where you mentioned all girls between the ages of you went a little break. You had a little break there. So could you help us again?
Okay, yes. So as regard vaccination is a form of prevention for cervical cancer. And what it does is that it prevents. Remember, I talked about the role of HPV in developing of cervical cancer. So a person that is vaccinated against HPV is able to prevent it. Because HPV is a antibody soldiers that would fight the virus once a person comes across the virus. And usually we recommend that this vaccine, because it is a form of what we call prophylactic vaccine, it should be given before a person get exposed to human papillomavirus. That is before sexual intercourse. So we usually target it for girl child between the ages of 9 and 15. Now, beyond the age of 15, it can still be given up to the age of 26. And more recently, some studies are going on to see whether it can be extended to the age of 45. But basically, the people that we focus on are pre-school age girls. And the World Health Organization, in terms of the elimination strategy, focus on girl child below the ages of 15, that is 9 to 15, having appropriate vaccination. Now, the next step in prevention is screening, and I've explained what screening is all about. There are different types of screening tests. We have the VIA, which is easily accessible, can be done in community. We have the pap smear, which is the commonest form of screening, especially in this part of the world, which has been used over the years and successfully used. And we have the more recent one, which is the HPV testing. Remember, we said that HPV is a cause of cervical cancer. It's a necessary cause of cervical cancer. Thus, if you test for it, especially the high risk one, it's not all HPV infection that leads to cancer, but there is those we call the high risk one. So when we test and detect the high risk one, we can treat appropriately. Again, I need to also emphasize at this point that it's not enough to screen, because especially for many of us in the advocacy world, we do a lot of advocacy, we do screening, but screening should be coupled with treatment, because when you detect an abnormality and you don't treat, then it's as good as not helping the woman. So we often talk about screening and treatment. So that is second pillar of the elimination strategy. The third pillar is treating those who have the disease in the early stage, and for those who have the advanced stage, giving supportive care so that they have a good quality of life. Remember that I talked about the fact that they are usually in misery, pain, bleeding, infection, smell. So we will need to give them palliative care, supportive care, to ensure they have a good quality of life while they are still alive, so that they live quality life. Give them spiritual support, moral support, physical support, and all the form of support they need. So this is what World Health Organization has recommended, and what we expect each country to do before the year 2030. And that's the new thing. The new thing is that the World Health Organization wants the whole world, the 192 countries or thereabouts in the world, but more focus on 78 countries in low and middle income countries, to ensure that they have 90% vaccination of their girl child before the age of 15, 70% screening of women that are up between the ages of 35 and 45, at least 2 times between the age of 35 and 45. Then 90% treatment of people living with cervical cancer. It is expected that if this is done, and everybody, all the countries does this before the year 2030, and we maintain this in the next century, that is by 20, but in the next 100 years, cervical cancer will be something of the past, just like we have smallpox being something of the past. And this is achievable. And a lot of countries are on the path towards this. Unfortunately, I won't say Nigeria is on the path uh, precisely, though we are making effort to be on the path and hope that we'll be on the path. And one organization that is doing that is the End Cervical Cancer Nigeria Initiative, which have an overarching goal of ensuring that Nigeria is on the path. And what we do there is we ensure that we are doing different projects which is aimed at ensuring that all of these things we talk about is achieved in Nigeria. A lot of NGOs in the country are doing that. The government is also trying their best, but there's a lot that needs to be done about that. I'm sure we'll come into what needs to be done too.
Yeah. Thank you very much. This is very, very insightful. There's a lot. I want to appreciate in Neoma Christine. She sent 100 stars. Thank you very much. I just saw the notice. So I want to talk briefly again on this vaccination. You mentioned the age at vaccination between 9 to 15 years. And then um, there's something that I want you to throw more light on. We know that boys can get vaccinated too. That's number one. Number two, how many doses of this vaccine is needed to actually say that we have protected these kids? How many doses? And can boys be vaccinated? If yes, is it the same? And how common are these vaccines?
All right, Fred, thank you very much. You've asked a very important and germane question. And to answer this question, I want to go back memory lane and bring us up to date to what we have today, because I'm sure many of our viewers would have a different number of vaccines that need to be given,
Yes.
when it should be given, and all of that, and it sounds confusing to a lot of people. So I'll go back memory lane about how it started. Human papillomavirus vaccine was introduced in 2007, and the brand that was introduced then was Gardasil. Then a year after, Savaris was introduced, and the recommended dosage then was that 3 doses needs to be given to all girls or all eligible person, usually given at contact. That's what we call zero, 1 or 2 months after, depending on the type of vaccine you are taking. Then 6 months after, and that was recommended up until 2010 or thereabouts, when new findings suggested that for girls below the age of 15, 2 doses are actually effective. And the way we actually determine the effectiveness of this vaccine is that, compared to women or persons that have had the infection and cleared the virus, the natural immunity they develop, we compare it to people that have vaccine. If the vaccine protection is above that of natural immunity, we say that the vaccine is effective. So those who have 2 doses still had that level of immunity above natural immunity, and it said that the vaccine is effective. So then it was recommended that 2 doses for people below the ages of 15, while those above the age of 15 up to 26 should have 3 doses. Now, we all know the challenges of the access to vaccine. That's one. Then two, researches keep going on because it's an ongoing research. The vaccine was introduced not too long ago. 2007 is not too long ago, and a lot of studies still going on it. And more recently, late last year, it was the SAGE, which is a group by WHO, recommended that a single dose vaccination is actually effective. And early this year, the World Organization has actually ratified that single dose vaccination. Then again, vaccination schedule is usually determined by nations. For now, the vaccination schedule for the country still maintains the two doses below the ages of 15 and three doses above the ages of 15. But I'm sure very soon, before the proposed introduction of the national program of immunization of HPV vaccine to the national program of immunization in the last quarter of this year, I suppose and I think that the Nigerian government or the regulatory body is going to recommend a single dose for those below the age of 15. But for now, we're still working with two doses for those below the ages of 15, then three doses above the ages of 15. Now, you talk about male vaccination. Like I said, human papilloma virus is an infection that affects both male and female. So vaccination is required for both male and female. And I need to mention also that though the emphasis of this conversation and the most important cancer that is caused by cervical cancer is, sorry, by human papilloma virus is cervical cancer. There are a lot of cancers that are associated with human papilloma virus. Cancers of the vagina, the vulva, the penis, the anus, even the throat are all related to human papilloma virus. So a male child can still be vaccinated to prevent this other cancer that I talked about, one, also to prevent him from transmitting it to the female partner. But when we talk about vaccination as program, as a public health intervention, we usually look at the common good of the society. We usually look at the government spending its scarce resources in the best way possible to achieve the greatest good for the society. So in such situation, with the World Health Organization, based on research that has been done, have not recommended that human papilloma virus vaccination be given to male child as part of a national program of immunization, but as a personal intervention, as a parent that is willing to protect his son, you can go ahead to get the vaccine for your son on your own. But in terms of free vaccination that we expect the government to do, vaccination of male child, vaccination of people above the age of 15 will not be a part of it. But that does not mean somebody above the age of 15 cannot get vaccinated. The same way it doesn't mean that a male child cannot be vaccinated. It's just that it is not recommended as part of a national program. There are countries in the world like UK, many countries in the world are already instituting male vaccination. And some
Mm.
of us in the low and middle income country are starting to query them for that. That we are having challenge and difficulty in getting access to the vaccine
The vaccine.
for our
Mm.
girl child, and they are going ahead to vaccinate their male child when they know that in terms of public intervention, getting more people, more girl child vaccinated will
Yeah,
help in
protects.
benefiting more than. But again, you can't blame them. They have the fund, they have the resources
Yeah,
to
yeah.
get the vaccine, and you know everybody is
Mm.
have some degree of selfishness in us.
Yeah, you can't tell a
You
man how to spend his money.
exactly.
Yes, thank you, sir. Before we go to what is new with regards to the prevention of cervical cancer, one more. There is this saying we are encouraging ladies to get screened for cervical cancer. I'm also encouraging that up to 26 years, a lady can get the vaccine. So, which one goes first? A lady goes to screen herself first before getting the vaccine, or she can take the vaccine after, then she goes for screening. How? Which one comes first?
Okay, the question you just asked now reminds me of very something very critical that I won't be happy with myself if I don't mention on this call. I'll come back to your question, but I need to emphasize that
Mm,
vaccination, I repeat, vaccination does not stop you from needing screening.
mm, mm,
It's just
mm.
an addition. So every woman needs to be screened, irrespective of vaccination status, at least for now. And the reason is that the human papilloma virus vaccine, uh, we have a lot, in many HPV
Oh, we're having a little network
for
glitch
all of them. So,
again.
so you
Okay,
can
you're
be
back.
vaccinated. You can be vaccinated against human papillomavirus. And if you do not screen, you can still develop the cancer. So even though the vaccine will give you a huge level of prevention against the cancer, you still need to be screened. So please,
We are having
just means
issues.
that it just means that you have an extra layer of protection against the. disease. Now, as regards vaccination and screening, which one comes first? Should you do this before that? This is a question even amongst us stakeholders is not so clear amongst us, but I will make it clear. Now, you do not need to get screened before you take the human papillomavirus vaccine. I'm sure some people may not agree with this because of the varying understanding of this, and the reason is clear. As part of public health intervention, we know that it is not cost effective to use screening as a prerequisite for human papillomavirus vaccination. And given the statement I made earlier that irrespective of your vaccination status, you will still need to be screened. So it is not cost effective as a public intervention to start screening every woman before you vaccinate. It's a waste of resources. Therefore, if a woman is eligible for screening, so vaccination, vaccinate her and encourage her to be on screening. If she has not had contact with the iris vaccine, the vaccine will help protect her. If she has had a contact with one of the iris virus, the other
Strains.
serotype will be protected. She will protect from the other serotype. And if peradventure she has had contact with all the iris and the vaccine will not be effective in her, it's just going to be one out of many compared to screening everybody before you vaccinate. Eventually you will be wasting resources. So what is recommended by World Health Organization is that we do not need to screen before vaccination. And once you are vaccinated, you should continue screening. So uh, screening is not a prerequisite before vaccination.
Mm.
We know that the vaccine is a prophylactic vaccine, meaning that it's protective when you've not been exposed to the virus. That is clear. But again, like I mentioned, we look at the cost effectiveness when we're doing health economics, and the cost health economics of vaccination does not support screening all women before
For
vaccinating.
vaccination. Thank you, sir. If you are just coming, you're welcome. Now, if you have any questions regarding this topic, cervical cancer, you can start dropping your questions so that I would ask Dr. Lawal to take your questions. So, my next question would be, what is new with regarding the prevention of cervical cancer? What are those areas of research, of development that we now have to help us with the prevention or the defeat of cervical cancer?
Okay, thank you very much. I've mentioned one or two new things earlier, but I will still mention it for emphasis. I'll pick it across the across board of all the prevention methods I mentioned. Now, HPV vaccination. In terms of HPV vaccination, talked about how we started and where we are today. We started from 3 doses, and now we're talking about single dose vaccination. And we expect that by doing single dose vaccination, we're able to have higher coverage, especially in low and middle income country. The cost of vaccination is a huge one. HPV vaccination is the most expensive form of vaccine that is in existence. It is said that the cost of a single dose of vaccine is enough to cover all the form of childhood vaccination. Although there are supports to especially for low and middle income countries for those who are eligible, what we call the Gavi support to bring down the cost. But
Mm.
by and large, also the access to it is also limited because of competition across countries to have access to the vaccine. There are limited number of producers of this vaccine. So the single dose vaccination that is just recommended now is a new thing, and we hope that with that we're able to have higher coverage and many countries will be able to meet the 2030 targets. Still on the vaccination, we previously started with the type of vaccine that covers just two type of the iris virus. Now we have vaccine that cover up to nine serotypes,
Strengths. Mm.
nice
Mm.
of the iris now, which is a new thing. Then before now, it's only two companies that are producing the vaccine. Now we have many vaccine. Don't let me say many, but we have more countries. Sorry, more companies
Companies.
produce vaccine. We have one in India. We have one in China that is producing a vaccine, and maybe the Nigerian government is going to get the Innovac, the one from the Chinese into the country. We don't know which one is coming yet. Maybe it's the Gardasil or the Innovac. We are optimistic by the last quarter of this year, the vaccine is going to come into the country. We've had several failed promises, but we are so optimistic this time around that it's going to work out. Now, that's about vaccination. In terms of screening, I also mentioned how we started and the gold standard, the most effective form of screening, what we call the high performance screening method, is human papilloma virus testing. And that is what is the main thing now. And a way of improving uptake is what we call self testing. And what is self testing? HPV self testing. It means rather than go to the hospital or go to the
Whoa. Network. Okay. We have lost Dr. Lawal due to network issues. Now I believe that we have learned a lot, but when he comes back, I would bring him back to the live stream. His network is quite bad. If you're just coming, you are welcome. We're talking about cervical cancer. We've spoken about the causes, the symptoms. We spoke about treatment, prevention, vaccination. So you're talking about what is new with regards to cervical cancer prevention. Spoke about the single dose vaccination, and talk about more companies that are now producing the vaccine. Yes, I can see we have some comments here, questions already coming in, but I want to appreciate those that sent stars. Thank you very much. Okay, I see your question, Josephine. Madam Josephine Soemimo, and Madam Taiwo Omosanya, I see your questions, and I hope that our guest will join us very soon. I guess he had a problem with his network, so I'm not going to take any answer. I can't give you the answer. Let's just wait for him. But tell me in the comment section, what have you gained? Okay, Dr. Lawal is back. I think he's back. Yes, yes, yes. Sir, are you? No, his network is still not stable yet. His network is not stable. When his network is stable. So tell me in the comment section quickly, everybody listening to me. Tell me. Oh yeah, I'm waiting for your comments. Those on YouTube, those on Facebook. Tell me. Nobody should do private chat or all your questions concerning cervical cancer. You have the privilege of asking our guest here. No. Okay. Very good. I see these questions. Okay, let's go. Let's go. I guess he's having issues with his network. Tell me, what have you learned concerning cervical cancer? Neoma, Christine, and Joseph, thank you so much for the stars. You guys are the MVPs today. Oh yeah, talk to me in the comment section. I'm waiting. The symptoms of cervical cancer. You can have discharge, you can have pain, you can have blood after meeting your partner, you can have smell, and then you could have waist pain, you can have leg pain, abdominal pain. Okay, let's go. I'm waiting for your comments. Oh yeah, tell me, drop in the comment section. Um, yeah, I'm seeing your questions now. I'm waiting for our guest to come in, and then I would ask him all your questions. Don't worry. I guess his network. He had a problem with his network. Let's see. Let's see. Okay, so someone says here in Europe, it's mandatory for women of certain age to go for smear test every couple of years, and it's free of charge for all women. Yeah, this is why we are hoping and praying that we'll get to this point where every woman will be screened free of charge. Every woman, and she'll be followed up. Right now, people are not even still aware of cervical cancer. People are not aware. Imagine. And it's not me now. Calm down now. Calm down. Let our guest come. and then I will ask him your question. He's not here. He's not back here. I hope he comes back. I have learned the cause, prevention, and treatments. I gained a lot. Okay, so let me chat up with him and see if if uh if we will be getting him back to join us. Let's see. Okay, so I'm trying to chat him up. Yes, there are some questions you are asking me, that I don't even have the answer. Let's see. Let's see. We have new comments here. We have new comments. Yes. Okay, Dr. Lawal is back. Yes. Hello, sir. Welcome back.
Hello. Sorry, the network went off and I've been struggling to get back.
Okay. Okay. Welcome
Um,
back.
yeah, thank you. So I was talking about the new thing as regards screening. So I was talking about
Yes.
self-testing and that a woman can collect the sample by herself and send it for screening. That will take care of the concerns about privacy and all of that. But again, this is not easily accessible in our environment. HPV testing, the cost of HPV testing is quite high, and we may still need our women to come out for screening using the readily available method up
That's
until when
yeah.
this form of screening like self-testing will be available. But is an option in developed country. So, and a lot of, in terms of treating the pre-malignant lesion, that is the diseases before it becomes cancer, there are a lot of innovations that are ongoing as regards that. But all of these things, uh, for us in low and middle income country, what we need to do is to make the best use of what is available for us. What we have with us is enough for us to actually prevent the disease. So we should not wait until all these big new things are available. We can make use of while we pray and work towards having those things. We should make use of what is available to us.
To us. Thank you. Now we have questions in the house. Let's take them quickly, sir, before we wind down. So Josephine Sowemimo is asking: is cervical cancer hereditary?
No, cervical cancer is not hereditary. There are cancers that have hereditary components, but cervical cancer is not one of them.
Thank you. The next question is
It
from
this is due to infection.
okay. The next question is from Taiwo Omosanya. Says, I took the vaccine about 8 years ago, 3 doses. Do I still need to take another one? Thank you.
Oh, Taiwo, you've had what is required of you. All you just need to do is to do the routine screening. If you have access to HPV testing, you can do it every 5 to 10 years, using the World Health Organization recommendation of 5 to 10 years screening. But for vaccination, you've had enough to protect you. And you've done very well. You've done what very few Nigerians have done.
Wow. Now we have another one from Ivie Ehis. Doctor, if you have been vaccinated against HPV, you should have your first screening at the age of what? And then every year, what's okay, and every year, what years, and every what years? So if you have been
All right.
screened or if you vaccinated and screened, okay, good. Let's
Okay, thank you. Now, the screening recommendation, the frequency of screening, and depends on the type of screening method that one has done. Remember, I said there are different forms of screening. For someone that have done HPV testing and the result was negative, 5 to 10 years is fine interval. Is a good interval. If you are using the recommendation of Sogon, every 5 years is what you should be screened. But if you are using the World Health Organization recent recommendation, 5 to 10 years is what should be done. So, but if the screening that you are using is the cytology, what we call pap smear, then you should screen every 3 years. And you start from age 25 and age 25 and you stop at age 60 if you have three previous tests that were normal or two previous tests that were normal, depending on whether you're doing cytology, that is the pap smear, or the HPV testing, respectively. I hope I'm clear.
Very clear, sir.
Fred.
Can a person with yes, very clear. Can a person with cervical cancer be able to conceive and go through normal delivery? This is from Namiko.
Okay, thank you very much for this question. Now, someone with cervical cancer, depending on what the person asking this question is referring to, one, we can have cervical cancer in pregnancy. It do occur. We've seen some cases like that. Then we can have women who have had cervical cancer treatment who are of reproductive age group. Because when we talk about cancer, many people think cancer is something for old women. I've seen people of 27, I've seen persons of 32 coming down with cervical cancer. So it's not just of old people. The average age may be 51 thereabout. It has two peaks, early age and later in life. But again, it can happen to women in reproductive age group. So that means that it can happen during pregnancy. And if it happens during pregnancy, if you detect cancer during pregnancy, the woman can still carry pregnancy depending on when it is detected. If it's detected very early in pregnancy, maybe in first trimester of pregnancy, usually we commence treatment, especially if it's at the highest stage. You commence treatment, and that will the treatment will eventually lead to death of the baby and eventually lead to miscarriage of the pregnancy. But if it occurs later in pregnancy, depending on the stage of the cancer, we can allow the pregnancy progress to an age where it can be viable and do a surgery to deliver the baby, because such a woman will not be allowed to deliver through the vagina because of the complication that I said with it. So such a woman can still allow to deliver, but not through the vagina, if that is what is being referred to as normal delivery. Now, because I mentioned that young ladies do have cervical cancer, and when such cancer is detected very early, and I'm emphasizing this very early, some form of conservative treatments can be given for such a woman, such that she can have some form of treatment that will still retain her womb, so that she can have babies or baby as it may. Then subsequent treatment will now be given to such a woman. So we can give some form of conservative treatment, and that includes the removal of the cervix, what we call trachelectomy, I made reference to earlier. Trachelectomy, that's removal of the cervix that I referred to earlier. So such treatment can be given to a young woman who is still desirous of having baby. But the proviso here is that such a woman should be seen very early in the stage of the cancer, because when the cancer is advanced, the only treatment that is applicable for such a woman is to remove the womb. And at best, what can be done for such a woman is to preserve the eggs, what we call the ovary, and use it for some form of reproduction, surrogacy, and all of that, so that the person can still have a baby that carries a DNA.
One more question. I think we are almost done because of time. One more final question. This is from Josephine. It says, could cervical cancer develop after menopause?
I think, okay, could it develop after menopause? Yeah, many patients that we see are actually postmenopausal women, and some may be perimenopausal. Usually, the cancer usually occur at a stage in life when the woman is supposed to be in the middle age of her life, enjoying her life. That's when the cancer usually affects women. So either when they are just about entering menopause, or when they are in the late phase of their reproductive life, that's when many of the women come down with it. So menopausal women can also actually present with the cancer. And that's why the screening does not stop until age 60 to 65. And for women who have never been screened before in their lifetime, they can actually still have screening beyond the age of 65 if we think is appropriate for them. When we say stop at age 65, we refer to people that have been on screening before then.
Sir, I want you to react to this comment, please, as we round up. Just a reaction. So this comment says another factor is that women need to be aware of their bodies so that they can spot changes in them early and seek medical attention. With regards to cervical cancer, what would you want to say with regards to this?
I agree perfectly that women need to know their body and able to spot and present early for seek medical attention for a lot of reasons. But for cervical cancer, this is very applicable when you talk about things like breast cancer, where you need to detect a lump early and you seek treatment. But for cervical cancer, you need to know your body, you need to present when you have abnormal symptoms. But again, what we want for women is that you should not even start having symptoms. You should not feel anything abnormal before you go for screening, because during that long period I mentioned earlier, between the infection and development of cancer, a woman is not going to have any symptom. You're not going to see any sign. It is based on screening, based on tests a doctor or a health provider does on a woman that will detect that these changes are occurring in the woman. So good and fine. Women need to know their body. When you see something unusual, present to the hospital. You see foul smelling vaginal discharge, present to hospital. After sexual intercourse, you bleed, present to the hospital. But these symptoms are actually late in the course of the disease. We want you to present to the hospital when you don't have symptoms so that we can treat you and you never get to have those symptoms.
I've heard some women say that when they went for the screening, mostly the pap smear, that they felt pain. So some other ladies are now scared of going for the screening. Could you help us briefly, sir, describe this procedure? Any pain? What should a woman who is making up her mind to go for the screening, what should she have at the back of her mind? Oh no, network. Okay. Christine, yeah. I guess you got Dr. Lawal's response. Okay. The network is messing up right now. I'm trying to see if he could be back to respond to us, but if he can't, then maybe we'll take this some other time. Now, some ladies have said that when I went for the screening, it's not painful. Thank you. Yes. So that others can see this. It's not painful. It's just a little bit discomforting. Very true. So if you are listening to me right now, you are a lady, a woman, you are sexually active, and you're trying to go for this screening, please don't be scared. It's not painful, though a little bit discomforting. Okay, Dr. Lawal is back. Hello, sir. Can you hear
Yes.
me?
I think I yes. Hello, I can hear you. Can you hear me?
Yes, I can hear you, sir.
Yes. So I overheard you making some comment. I think exactly that's the point. That the cancer, the screening, if we had feedback like that, that's true. But the screening is not supposed to be painful. What you can, all at best, there is discomfort because they need to expose the neck of the womb. But pain is not part of it because the process of doing it is not causing any harm. It's just scraping. And when we say scraping on the surface, just trying to like moving something over a surface. We're not injecting, we're not doing anything that should cause to get it done.
Thank you. Evie, I wanted to shut down, but because you are the one, so let me allow Chief respond to you. Doctor, but you said the symptoms are vaginal bleeding between period or heavier than usual. Dr. Lawal, can you hear me? Oh, Dr. Lawal is not here. Okay, so Evie, the symptoms, there are so many other medical conditions that could have symptoms that look as if you have cervical cancer. But what we have said is that some women might even have no symptoms at all, but they can have the lesion there gradually. Sometimes they might have discharge, vaginal discharge. This discharge might be smelling, might have color. They can have bleeding during intercourse, bleeding during their period, bleeding after menopause. They can have lower abdominal pain, some can have back pain, some can have gradually, when now progresses, you can have weight loss, can have leg pain and the rest. So this is why we are saying that you should not wait, get yourself screened. Is that okay? Yeah. So, ladies and gentlemen, I want to appreciate every one of you for taking out time to join me tonight. Thank you very much. I want to thank Dr. Lawal. His network has been acting up so bad today, but we are sincerely very, very grateful. One appeal I have for you all today, I beg, Biko, Joe, please share this live stream. Please let your people watch this video. That is all I have to say. Thank you. Like I'll always say, good life. Good life in that sense. Thank you to all those that shared stars on this page. God bless you. I'll see you same time next week, Sunday, on this platform. Remember, good life in that sense. Take care and bye bye.